And we're going to expand on that now. For more on our coronavirus coverage, we want to bring in Dr. Larry Burchett to talk about this. Dr. Larry, thanks for joining us today. Let's just start off with Governor Newsom. No doubt, not really a good look here for what he did in terms of this outdoor dinner party. How do his actions impact the public messaging about the virus?
Certainly, it's confusing to, in words, say, hey, don't do all these things, and then for him to have a gathering, 12 people, even though it was outside, you can't sit down, have a meal where you don't have your mask, and then you're close together. Kind of those two basics that we've been pushing, wear a mask and keep a distance. It hurts to see the leader of the state doing that, for sure.
Let's talk also about the coronavirus cases that we're seeing here in the Bay Area. A lot of our counties are now moving backward. What is your reaction to that in terms of having these rollbacks on reopenings?
Christina, I think a lot of public health officials have been predicting that as it gets cold and as we all move inside, that we're going to see increased cases. So it's not at all surprising that as cases go up, which we measure in various ways, we have to tighten down with another step of closing indoor dining, pulling back on gyms and movie theaters and talking about schools and all of that stuff. So it's not surprising. One thing I do want to say about Gavin Newsom, specifically with a lot of this contact tracing, we've been seeing that small private gatherings have been a significant source of spread. So a lot of people, know, okay, don't go to a big concert, big gathering of people. That's certainly out. But it's easy to be fooled thinking, okay, I can have some people over. That's okay. Heading into Thanksgiving, I really want people to think about, should we be getting together with people who are older, who may have medical conditions? Is that the right thing? Because we're learning from this that the virus really does spread in exactly the setting that Gavin Newsom was in. Dinner parties of 10 and 12. The timing of this actually is good to emphasize that's a place of concern heading into Thanksgiving.
Yeah, especially since we've seen a lot of these cases increasing, not just here in the Bay Area, but across the state. We hit that milestone yesterday. I mean, you're saying you're not surprised to see this. What do you want people to understand? We hit 1 million cases on Thursday.
So I do want to put it into context of the entire country. If you divide it out per person or per 100,000, California has done much better than most of the country, certainly better than the North Dakota, South Dakota, Wisconsin. Those guys have way more cases per person than we do out here. And the reason I think that we've done so good in California is good leadership and people that have followed that. Now is the time, as we're making it. So, what happens? Cases go up and we do something about it. We change what we're doing. We act a little bit differently, closing indoor dining and so forth. I think for the average person watching this, we still have to stay vigilant. I know people are fatigued of this. I am. But now, especially heading into holidays, is not the time to let your guard down. Still do your social distancing, wear your mask, be smart about holiday gatherings. We're going to get through this thing, but California has done better than most of the country. And this is why, because when things have gone up, we've done something about it.
I'm curious to know your thoughts on our case growth. For putting it into perspective of California versus the rest of the country, what about the rest of the world?
Well, unfortunately, coronavirus worldwide, you see this ebb and flow. And you see this in our country as well. California and the rest of the country in the summer kind of went up, and then we ratcheted things down. People took it seriously. Things went, cases went down, and then it came back up. When you look at Europe, there's a similar story. It went up, they intervened, and people took it seriously. Things went down, and then it went back up again. So we're seeing these waves, especially in places where, we are kind of ratcheting down. But all over the world, unfortunately, COVID is still a pandemic.
Sure. And also important, a reminder for the public to get their flu shot as well, even though we're still in the middle of a pandemic. Dr. Larry Burchett, thanks for joining us tonight.
Thanks, Christina.